Lifestyle choices can reduce your risk of cancer, like wearing sunscreen can reduce your risk of skin cancer, or stopping smoking can reduce your risk of lung cancer. But losing weight may have even more superpowers when it comes to fighting cancer.
Joining me now is Dr. Frank Chae, a bariatric surgeon with the Denver Center for Bariatric Surgery out at Skyridge. And Dr. Chae, we're talking about this new study that recently came out linking weight loss and cancer risk with a pretty big headline here. Tell us about the study.
Well, this is one of the best landmark studies that came out in this decade, and it's going to go down as one of the pivotal studies that the medical community will be using in the long future ahead. What it shows is a clear link between obesity and cancer, and there's a direct correlation. So that when there's a substantial amount of weight loss, there's also substantial reduction in death from cancer, and that includes cancer incidence as well as longevity as well. So that's why this is such a wonderful, wonderful study.
So I know it's different for everybody, but when it comes to how many more extra pounds and how much of an increased risk for cancer, what's that kind of correlation according to these studies?
Weight loss surgery is a really effective therapy option for weight loss. And in this study, it referred to the surgical population where they lost dramatic amount of weight loss, 60 pounds or even higher. Now, accordingly, we also saw substantial dramatic reduction in cancer with that amount of weight loss. So what this clearly shows is that at least 60 pounds of weight loss will have a dramatic impact on cancer, but we can also take that as a positive. So first of all, cancer risk is directly reversible. So when you lose weight, you also lower the risk of cancer. So we should all lose as much as we can. It doesn't have to be 60 pounds. There are no studies yet, but it's underway for now. But we feel that even 10, 20, 30 pounds of weight loss will have a positive impact.
So then what would you suggest for our viewers sitting at home hearing this information thinking, well, maybe it's time that I lose a few of those extra pounds?
40% of us in the USA, the adults, suffer some degree of weight gain and obesity. That's a huge population, obviously, and not everyone qualifies for what I do, weight loss surgery. But before we get there, we can start with our local help that we can get from gym membership, dietitians, and then also we can step up to the plate and talk to our primary care providers and see what medical therapies that they're eligible for. So it's just to get active and get going, because this is just like cigarettes. If you stop smoking, you reduce the risk of cancer. If you start losing weight to any degree, you start lowering the risk of cancer.